In a big boost to India's Omicron fight, the centre has announced vaccine rollout for kids. The centre has announced vaccine for children between 15 and 18 from 3rd Jan in a Christmas address to the nation by the Prime Minister. This after the DCGI approved emergency use or approval for Covaxin for children, a 2-dose jab for children between 12 and 18 years. However, children between 15 and 18 years are going to be administered the jab from 3rd Jan. According to sources, the centre will need to give orders to Bharat Biotech for children's vaccine. This is a 2-dose vaccine as opposed to Zydus, which is a 3-dose vaccine.
पंद्रह साल से 18 साल की आयु के बीच के जो बच्चे हैं, अब उनके लिए देश में वैक्सीनेशन प्रारंभ होगा। 2022 में 3 जनवरी को सोमवार के दिन से इसकी शुरुआत की जाएगी। ये फैसला कोरोना के खिलाफ देश की लड़ाई को तो मजबूत करेगा ही, स्कूल कॉलेजों में जा रहे हमारे बच्चों की और उनके माता-पिता की चिंता भी कम करेगा।
This has been a very important step, and this is one step that we've been persuading and certainly advising for a long period of time, at least for the last 4 weeks. We must remember that our 12 to 18-year-olds are a very important subgroup of 15 crore youngsters who are in the formative years of life. And certainly for the healthcare workers, it was very clear that we were at least 10 months away from our second doses. With Omicron around the corner, this army of workers, the frontline workers and the healthcare workers, is absolutely in need of being fit and healthy and motivated to actually save the country from what is an inevitable third wave. So I'm happy that the experts actually listened to the advice of everyone. I'm happy that we did not wait for our own data. We relied on what was clearly overwhelming Western data to tell us that we were at most susceptible. We had the least effective vaccine against Omicron, and that we have a susceptible population which needs to be vaccinated. So I'm truly happy. I think this is an important step forward.
Dr. Arun Gupta, Chairman, Delhi Medical Council Child Specialist, is now joining us on the phone line. Appreciate you, sir, taking the time out. Very good morning. What's your take on children getting vaccinated? Is this a need of the hour? Are there any fears at the moment that you'd like to allay as far as parents are concerned, probably are in double mind about getting their children vaccinated?
I think, first of all, I just welcome this announcement by the PM. So I think this announcement is a bit kind of delayed on maybe probably half-hearted. As far as children vaccine is concerned, we always wanted our children to get vaccinated, but the problem was availability of a creditable vaccine for the age group. Now, as soon as the vaccine is available, I think every parent should go and get their children vaccinated. That is very, very important because COVID is still around the corner and it's coming in different
Do you think India is a little late in the game as far as the race to get children vaccinated is concerned, if you compare what's going on globally?
I think India is far behind the race, even the adult vaccination is concerned. I would say only 37-38% vaccine has been given to the adult population. So that is not a very good figure to quote. But children, the bottleneck was always availability of the vaccine, and some Western countries are vaccinating children up to 12 years of age. So I think as soon as the vaccine is available, they should go all out to vaccinate children, maybe 15, maybe 12, or maybe 2 years down the line. And as far as the booster dose is concerned, I think that is a bit delayed. Even 10th January is 15 days from here. I think they should have been enrolled maybe next 48 hours. And our healthcare workers, why only healthcare workers? Healthcare workers have to be given, but all those states where the vaccination rate is very good, like Delhi, where 100% population has been given the first dose, and more than 70% population has been given second dose, simultaneously a booster dose can be started in Delhi, at least for maybe states like Delhi where the vaccination penetration is good, for all the people. So
sir, isn't there a caveat that between your second dose of vaccine, you have to give it 6 months before you get the booster dose, or can you get it sooner?
Yeah, I think that is a scientific question to be answered because as per our knowledge, our wisdom, and our studies, we know that the antibody level tend to come down after a few months of the primary vaccination series. Now,
Right.
various studies have been quoting the level of antibodies coming down from 3 months to 9 months. So that as a decision has to be taken, but I think 6 to 9 months is a wise decision for the second dose. So I think for the booster dose, so I think it's a right decision in the right direction, but it should have been bit earlier, and I think 10-15 days from now it's a bit too long also.
So you're saying that it's a little too late in the day to have taken this particular action. And as far as different vaccines are concerned, right now, Covaxin has got the approval for vaccination for kids above 12 years of age. Would you like to see the other vaccines being approved? Which ones do you think are apt for kids?
I think the studies are on as soon as the data is available, or you can rely on the Western data as well, because it's a global problem. They don't have to have a data from every sexual society. Now, once a single virus is roaming around the world, I think depending on the Western data, you can start vaccinating children also. So maybe 12 years, maybe it's 6 years, or maybe 2 years, depending on the availability of the vaccine. I think they should go all out.
I really appreciate you joining us on this broadcast, Dr. Arun Gupta. That's very clear clarity coming in from Dr. Gupta on vaccination for children. Thanks so much for being here on the broadcast with us.